My name's Steve Camper, and you know what I like? Research. We're going to talk about research today. So this is a mini lecture called Why Even Bother? So it does what it says on the box, right? So we're going to talk about why bother engaging with research at all. So the reality for all you clinicians out there is that you don't have to read any research at all. I guarantee you can have a career treating patients and never ever pick up a research paper. I guarantee you will run into colleagues for whom that's true. They might spend 5 or 10 or 20 years or in fact a whole career and never read a research paper. So what that means is that you have to make a decision. You have to make a decision whether or not to engage with research, and if you do decide that you want to, how are you going to do it? So, why engage with research? Why even bother? So I can give you 3 reasons, and I reckon they're pretty compelling. And the first one is about patient outcomes. And so we have quite good evidence that where you have health systems and clinicians who engage with research evidence, who are involved in conducting research, on average, the patients in those systems treated by those clinicians do better than the patients in other health systems. All right? So there's an argument here that being involved in research, engaging with research evidence is better for your patients. All right, so that's one. And maybe that's compelling enough by itself. But here's another reason. Another reason is that the public, and the public from whom your patients come, and your professions have an expectation that the treatment that you provide is based on scientific evidence. Okay, so your profession, no matter what it might be, I guarantee will be saying that we make treatment and clinical decisions based on scientific evidence and scientific understanding. And similarly, that's what patients who come to see you will expect. They expect your decisions to be informed by science. So what that means, that has 2 implications. One is that there's a body of research which is relevant to the work that you do, and that's almost certainly the case. And secondly, it means that the professionals, the clinicians who are registered with that profession and providing services to patients, interact and use that evidence to inform their decisions. So that's reason number 2. The third reason is a practical one, and that may be at some point the people who are paying for treatment, and whether that's patients directly or whether that's insurers or whether that's someone involved in administration of the care, will be asking you to justify what it is that you do. So what that means, well, what research will do for you there is offer you a way to justify the decisions that you make. Right, so there are 3, in my opinion, pretty good reasons for engaging in research as a clinician, engaging with research as a clinician. All right. Now you might have some reasons of your own, okay, and there's lots of reasons. So you might have decisions, you might have questions that you don't know the answer to. You might have it, and they might relate to a particular type of patient or a particular patient individually, and you're not sure what to do. You're not sure how to make the clinical decisions that are the best for that patient. So research can often help with making those decisions. You might also realise that as time moves on, knowledge about conditions and knowledge about the way that humans work, their health in particular in this case, it changes over time as we develop more understanding. So that's a couple more reasons why you might engage with research. And I'm sure that if you thought about it, many among you could come up with other reasons as well, or have your own reasons. The point I really want to make here is engaging with research is your choice. Okay, and in my opinion, it's worth you as an individual spending a little bit of time working out why it is. What's your motivation for engaging with research? And that might help you, motivate you, help you to make to decide how it is that you want to engage with research. So before I go, I'm going to give you a little bit of homework. And the homework is to spend some time thinking. And that time I want you to spend thinking about 3 questions. So the first one is this: how do you know what to do with the patient in front of you? Right? So how do you know? What information do you use to make decisions about how you're going to treat your patient? So that's number 1. The second question I want to leave you with is this: how will you know that what you've done has been successful? Put another way, how will you know whether what you do works for that patient? So that's the second question. The third is this: how is your practice, what you do for your patients, how is that going to change over time? So that's the third question. Alright, cool. Thanks everyone. I hope you enjoyed it. If you liked it, get in touch. I'm easy to find. Love to hear any feedback, any requests or stuff you'd like to hear about. Cheers.